Assalamualaikum warahmatullahi wabarakatuh. My name is Similuman bin Muhammad Syaril and my matrix number is 2025516867.
My name is Harith Nakuddin bin Shaifuddin. My matric number is 2025136555.
Hi and Assalamualaikum. My name is Nur Ali Izzati binti Muhammad Nazir and my student ID is 2025150687.
Hi, my name is Nur Ashikin binti Abdul Hamid and my matrix number is 2025303317.
My name is Nur Nadira binti Ruzaimi Sukri. My matrix number is 2025121941.
The first one is introduction. Our policy is about the National Oral Health Policy that was introduced by the Ministry of Health Malaysia and has been approved by the Cabinet on 18 May 2022. The time frame for this policy to be implemented started in 2022 until 2030. This policy is a continuous effort from the government from the previous National Oral Health Policy that was implemented in 2011 until 2020. The policy was developed and continued due to high rates of oral disease among the communities in Malaysia, such as oral cancer, periodontal disease and also dental cavities. Alongside with this policy, the government through the Ministry of Health Malaysia also implements and introduce the National Oral Health Strategy Plan as a guidance and also coordinations for the programs and strategies to use in this policy. Move on to the next one is the policy problems. We have 5 different policy problems in this policy. The first one is high prevalence of oral disease. Next one is low utilization rates and accessibility to oral healthcare. The next one is financial barriers of oral healthcare, followed by unequal distributions and skill gaps among oral health professionals. And the last one is low investments in oral health technology in Malaysia. Apart from that, this policy also contains several objectives. The first and foremost is oral healthcare system, partnership collaborations, community empowerment, research and development, standards and monitoring, and also the last one is digital transformations and informations. These policy problems and also policy objectives will be explained in the next slides. So we move on to the policy problem. One of the policy problem that has been explained in this policy is the burdens of oral disease remain high. Oral related disease remain one of Malaysia's major public health issues. The common problem that has been faced among the communities in Malaysia includes tooth decay, gum disease and also oral cancer. This policy has acknowledged oral disease burden as one of a serious national health concerns. Next one is the factors that contributing to this issue. Firstly is the limited access to a proper oral health care. This issue usually happens among the citizens and peoples who live in the rural and low income areas. Secondly is the socio-economic disparities influence access to a dental care and prefer for a medications habits instead of having a proper treatment. And the last factors is unequal distributions of oral health professionals, including doctors, dentists and also surgeons across Malaysia. We move on to the survey findings. Reportedly, 5.5% of adults are facing dental problems. They came from various backgrounds. They came from a different ethnicity, income and also education levels that will influence on how they take proper precautions on maintaining a good oral health conditions. Even though the statistic for the caries among the children is reducing, but it's remain high. Among the 5 years old children, the data show that 71.3%, and meanwhile for among the 12 years old children, The data shows 33.3% of among them are having a dental issue. Apart from that, only 21.7% of the older adults have less than 20 teeth, and 93% of them face dental issues. So what does this policy response? National oral health policy strengthens preventive measures and encourages stakeholder collaborations. Apart from that, the policy also ensures that equitable access and improve quality of life through a better oral health outcomes.
The second policy problem, which is the low utilization rates and accessibility to oral health care in Malaysia. Dental services in our country are provided by both the public and private sectors, but the main provider is the Ministry of Health through its dental health program. According to the National Health and Morbidity Survey 2019, about 79.5% of Malaysians rely on public dental services because they are cheaper and highly subsidized by the government. However, this heavy reliance has caused overcrowding and long waiting times at public clinics. On the other hand, private dental clinics are more efficient but remain unaffordable for many citizens. The use of dental services has actually been decreasing from 27.8% in 2015 to only 23.7% in 2019. The most active users are school children aged 10 to 14 years old, mainly because of the school dental program. But the least active users are young children and adults who actually have a high risk of needing treatment. Many adults believe they don't need dental checkups unless they feel pain, showing that health literacy is still low. In fact, only about 40% of Malaysians have adequate health literacy. This clearly shows that accessibility and awareness remain serious challenges in achieving better oral health for all Malaysians.
The first problem is limited government funding. Malaysia faces a serious financial challenge in providing accessible oral health care. Our system depends on a dual public-private structure, but the public sector remains underfunded. In 2019, only 2 to 3% of the Ministry of Health total budget was allocated to the oral health program, while the country's overall healthcare spending was just 2.58% of the GDP, far below the World Health Organization recommendation of 7%. This limited allocation creates a heavy strain because almost 79.5% of Malaysia rely on public dental service. As a result, the demand for affordable treatment for exceed what public clinic can provide, leaving many patients under safe and increasing waiting time for cares. Next, the second problem is high cost of oral disease. The cost of managing oral disease, especially parodontitis, has become one of the largest contributors to the national healthcare burden. A study in 2016 estimated treating all cases of parodontitis in Malaysia would cost around 37.1 billion. This amount is equivalent of 60% of the Ministry of Health total budget and about 3.83% of Malaysian GDP. Moderate parodontitis, which is very common among adults, make up most of these costs. This show that untreated or poorly managed oral disease not only affect individual health but also place significant financial pressure on the healthcare system and the national economy as a whole. The third problem is expensive specialist treatment. The financial burden extends even further when we look at the specialist level treatment. Non-surgical periodontal management in public dental specialized clinic alone costs around 485 million each year for about 66,600 adults. In private specialist clinic, the figure adds another 211 million for roughly 70,000 adults. Altogether, this amount to nearly 700 million spent annually on specialist treatment alone. This highlights how expensive oral health care can be once disease reach an advanced stage, and it emphasizes the importance of prevention care and early intervention to reduce costs. The fourth problem is high out-of-pocket expenses. Although government funding still account about 57.9% of total national expenses, there is a significant gap in dental coverage because public dental services are limited. Many Malaysians, especially those who are low-income household, have no choice but to seek private treatment, which can be costly. The result is high out-of-pocket expenses that can be financially devastating for lower-income families. In the same case, people may even delay or avoid treatment due to the cost, which lead to the worsening oral health and higher expenses in the long run.
Next policy problem is human resources distribution and skills imbalance. Malaysia has improved its dental workforce with a ratio of 1 dentist for every 2816 people in 2020, similar to countries like New Zealand and the UK. But the real problem is uneven distribution. Most dentists are in Peninsular Malaysia, while Sabah and Sarawak have the lowest ratios. This imbalance means rural areas lack access to care. To fix this, the government needs better workforce planning and a national policy that ensures fair distribution across all states.
The fifth policy problem in the National Oral Health Policy is the gap in oral health technology investment, highlighting insufficient digital infrastructure, funding, and system integration in Malaysia. Most facilities still use manual records that would cause storage, data loss, and inefficiencies, while EMR adoption is limited and not interoperable. Key challenges include inadequate infrastructure, lack of skilled personnel, and financial constraints, limiting access to modern dental technologies and slowing progress towards Industry 4.0. Malaysia's commitment to phase down dental amalgam also requires investment in alternative materials and early detection technologies. Strengthening digital investment, system integration, and workforce capacity is crucial for efficient, safe, and patient-centered oral health care.
The second objective of Malaysia's National Oral Health Policy 2022 is to ensure that oral health care is comprehensive, accessible, and equitable for everyone. This means the policy aims to provide services that are available, affordable, acceptable, and appropriate for all Malaysians, especially for vulnerable and underserved groups. The goal aligns with the broader national vision of universal health coverage, which ensures that every individual receives the care they need without financial hardship. It also focuses on collaboration between the public, private, and non-profit sectors to deliver quality and efficient services. Another key aim is to promote lifelong oral wellness through early intervention, community empowerment, and preventive practices. In short, this objective supports Malaysia's health equity agenda and helps improve the overall quality of life of the population.
So, another objective of the National Oral Health Policy is to intensify interagency collaboration in providing oral health care. This means building strong networks between government agencies, private sectors, and non-profit organizations. Such partnership help share expertise, provide training, and distribute dental professionals where they are most needed. This is crucial because most dentists are concentrated in Peninsular Malaysia, while Sabah and Sarawak remain underserved. Strengthening these collaborations improves efficiency, quality, and accessibility, ensuring fair and inclusive oral health care for all Malaysians.
We move on to the next policy objective. The third policy objective is to strengthen community empowerment. First and foremost, let's begin with the focus. This strategy focuses on encouraging active public participations in improving oral health and involving the Malaysians to collaborative efforts to achieve a better oral health outcomes. The goal is to make the communities as an active partners in maintaining oral hygiene and not just passive recipients of service. Next one, we move to the aim of the objective. The main aim of the objective is to foster healthy behaviors among the communities to maintain good oral hygiene while also increasing public knowledge about preventive oral care for long-term benefits for the communities. This ensures that the people understands the importance of regular dental visits, proper brushing techniques, and also healthy dentary habits. Next, the methods. To achieve this aim, the Ministry of Health implements educational campaigns such as program Komuniti Sihat Pembina Negara or known as COSPEN, where trained volunteers are sent to promote oral health awareness to the community among the Malaysians. In addition, the outreach programs like the Kampung Angkat Pergigian programs are conducted to reach the rural area in offering oral health tasks, screenings, and also demonstrations on correct brushing techniques. These efforts will help to improve understanding and encourage preventive dental care practices across different communities. And the last one is for the community roles. So community are important and encouraged to take responsibility for their own oral health, such as by adopting positive habits and influencing orphans to do the same. The strategy also emphasizes collaborations between communities and various sectors, including schools, NGOs, and also local authorities.
One of the key goals under Malaysian National Oral Health Policy is to strengthen research and development to improve the quality and efficiency of oral health service. They aims to ensure our system remains evidence-based, innovative, and adaptable changing public needs. Firstly, the policy focus enhance oral disease surveillance to understand the prevalence and severity of oral disease, ensuring resources are used effectively. Secondly, it's promote more oral health research through collaboration between universities, government agencies, and private sector to develop stronger programs. The third one is health economic studies and encourage to the assess of financial impact of oral disease for better planning and fund allocating. The policy also support digital transformation such as data management, online health education, and teledentistry, which target to complete national survey and continuous evaluation by 2030. Lastly, nationally coordinate research, including NOHRI conference, aim to translate finding into improved policy and service. Although this effort will make Malaysia oral healthcare more efficient, innovative, and responsive to public needs.
The fifth policy objective of the National Oral Health Policy focuses on digital transformation and innovation in Malaysia's oral health sector. Its goal is to improve service delivery, patient care, and health record management through tools like electronic medical records, also known as EMR, and the Oral Health Information System, also known as OHIS, that would integrate multiple healthcare providers for safe and convenient data sharing. The policy also aims to increase access to advanced dental technologies and digital diagnostic tools for early detection of oral issues, supported by investment in digital infrastructure, skilled personnel, and innovative solutions that would strengthen Malaysia's oral healthcare system.
There have been several strengths observed in the implementation of Malaysia's oral health policy. For instance, initiatives such as the school dental service have significantly improved access and awareness among school children, leading to better preventive care. The mobile dental clinic service has also successfully reached remote and rural populations, showing the government's effort in promoting equitable access. However, despite these achievements, challenges remain. According to the National Health and Mobility Survey 2019, only about 23.7% of Malaysians use dental services, even though many needed treatment. Most adults still believe dental care is unnecessary unless they are in pain, showing that oral health literacy remains low. Accessibility issues also persist, especially among low-income groups, due to affordability and location barriers. In summary, while Malaysia has made good progress in expanding infrastructure and outreach, the challenge lies in changing public behavior and ensuring consistent, equitable use of services.
So, next strategies is improving oral healthcare access through partnership collaboration. Teledentistry services like the Visual Dental Clinic and SJTK KKM connect patients in remote areas to dental professionals. These platforms were developed through collaboration between MOH, Mampu, the Malaysian Dental Council, and MySejahtera, ensuring better coordination. To complement this, The Community Dental Health Services Program uses mobile dental teams and outreach centers, including UTC and RTC, to serve the elderly, people with disabilities, orang asli, and rural communities in Sabah and Sarawak. Together, these efforts make dental care more inclusive and accessible nationwide.
Strategies in the National Oral Health Policy is the community empowerment. So this strategy focuses on encouraging individuals and communities to take control and their responsibility of their own oral health. It aims to strengthen preventive practices and create shared responsibility between healthcare providers and also the communities. The main goal is to shift from a treatment-based model to a more sustainable prevention system. To implement this, the government through the Ministry of Health works collaboratively with the local leaders and community, especially in undeserved and rural areas. This ensures that oral health activities are relevant and community-driven. For an example, the initiative that has been introduced by the Ministry of Health is the Kampung Angkat Pergigian program. This program was launched in June 2023 and officially introduced at Rumah Richard Pai, Miri, Sarawak. This program identifies a number of 57 rural areas and villages across Malaysia. This program focuses on empowering oral self-care and improving oral health literacy among rural communities. It uses a collaborative approach, training locals to deliver oral health educations, conduct screenings, and also promote preventive care. Furthermore, community monitoring groups are established to conduct a regular dental checkups and follow-ups, ensuring sustainability and long-term impact. Overall, the strategy was building a local capacity, increase health awareness, and also promote a healthy culture of shared responsibility between the communities in Malaysia and also the government.
The National Oral Health Strategic Plan focuses on digital transformation in oral health care through advanced tools like electronic health records, known as EHR, teledentistry, and artificial intelligence. These technologies improve data sharing, diagnosis, and treatment, making services safer and more efficient. The plan promotes digitalization and system integration to enhance early detection, service quality, and preventive care. It also prioritizes workforce training to strengthen digital literacy among dental professionals, ensuring proper use of systems like EMR and TPC or HCIS for effective and connected oral health management in Malaysia.
Under the National Oral Health Strategic Plan 2022-2030, research and development plays a key role in strengthening evidence-based oral health care Malaysia. The goal is to ensure all programs are guided by the accurate data, scientific research, and continuous innovation. Firstly, the plan focuses on improving oral disease surveillance, collecting reliable data on oral disease trends to design effective, targeted intervention. Secondly, is to expand research and innovation to better understand oral health challenges and create improved prevention and treatment methods. The plan also emphasizes adopting new technologies and modern service models to make oral healthcare more efficient and accessible. Another focus is on collaboration with universities, research institutions, and professional bodies to share experiences and stay aligned with global advancement. Overall, these efforts reflect the government's commitment to building a knowledge based on sustainable oral health system and enhance the quality, effectiveness, and well-being of Malaysians. Under the National Oral Health Strategic Plan 2022-2030, research and development plays a key role in strengthening evidence-based oral health care Malaysia. The goal is to ensure all programs are guided by the accurate data, scientific research, and continuous innovation. Firstly, the plan focused on improving oral disease surveillance, collecting reliable data on oral disease trends to design effective, targeted intervention. Secondly, is to expand research and innovation to better understand oral health challenges and create improved prevention and treatment method. The plan also emphasized adopting new technologies and modern service model to make oral healthcare more efficient and accessible. Another focus is on collaboration with universities, research institutions, and professional bodies to share experiences and stay aligned with global advancement. Overall, these efforts reflect the government commitment to building a knowledge based on sustainable oral health system and enhance the quality, effectiveness and well-being of Malaysians.
So now we continue with the policy evaluation. Either it will be strength or weakness. So the first strength of this policy is the reductions in the burdens of oral disease. Through the implementations of the National Oral Health Policy, Malaysia has made gradual improvement in reducing oral disease. This initiative emphasized preventive dental care aiming to stop oral health problems way before they start rather than only providing treatment. As a result, this program have helped to strengthen oral health promotions and improve consistency in dental care delivery across different communities. Now looking at the data for children and adolescents, among 12 years old, the percentage of caries-free children increased from 63.2% in 2011 to 75.2% in 2022. For 16 years old, the rate improved slightly from 55.3% in 2011 to 56.5% in 2022. In 2023, 64.7% of secondary school children were reported to be caries-free. This figure shows a positive trend and reflects the success of preventive efforts from the governments that has been implemented in schools and among the communities. To maintain and enhance these achievements, several strategies has been put in place. Firstly, Malaysia promotes a comprehensive national oral health strategy. Secondly, school-based preventive programs are implemented to encourage children to maintain good oral hygiene habits. And thirdly, mobile dental and community outreach service are provided to reach remote and undeserved area. And the last one is the focus is on strengthening preventive care and early interventions to ensure long-term oral health improvements. As a summary, the strength of this initiative lies in the focus of prevention, accessibility, and also consistency. This policy has give one of the best evidence that their framework is working really well.
The Malaysian oral health sector faces significant weaknesses in technology, digital integration, and infrastructure, which hinder effective and holistic care. Many clinics and hospitals lack stable internet, modern hardware, and secure systems to support EMR and OHIS. While a shortage of skilled healthcare and IT personnel makes adoption and maintenance difficult, limited funding often prioritizes urgent services over long-term digital transformation, which restrict access to modern dental technologies. Additionally, low digital literacy and resistance to change among healthcare staff result in uneven implementation. Together, these challenges lead to inefficient information management, poor provider integration, and underutilization of technological innovations, ultimately limiting the quality and comprehensiveness of oral healthcare in Malaysia.
To achieve the second objective, which is to ensure comprehensive, accessible, and equitable oral health service delivery, the Ministry of Health has introduced several key strategies to redesign the oral health care system. The main focus is on improving access, equity, and affordability, particularly to marginalized and underserved groups. Among the initiatives are the mobile dental clinic service and the community dental caravan program, which bring essential dental care directly to rural and remote communities. Meanwhile, programs like the school dental service and preschool oral health program continue to promote preventive care and early intervention among children. The policy also promotes collaboration between public and private sectors to share resources, improve appointment system, and expand service coverage. Lastly, integrating oral health services into primary health care ensures that dental care becomes part of general health. This redesign supports Malaysia's long-term vision of universal health coverage while addressing gaps in access and utilization.
Move into the next weaknesses. According to the Ministry of Health's 2024 health indicators, Malaysia's dentist to population ratio improved from 1 to 2816 people in 2020 to 1 to 2343 people. This means the number of dental practitioners has grown, but the main problem remains unequal distribution across states. Sabah has a ratio of 1 to 4854 people, and Sarawak has 1 to 3691 people, much higher than peninsular states. Government initiatives like teledentistry and mobile dental teams improve access but cannot replace physical practitioners. These efforts are temporary and do not solve the long-term imbalance in rural areas.
To improve the policy's effectiveness, several recommendations can be made. First, we need to strengthen oral health education through continuous public awareness campaign and school programs, so people understand that prevention is better than cure. Collaboration with the Malaysian Dental Association and local communities can help spread these messages more effectively. Second, the mobile dental services should be expanded and teledentistry could be introduced to reach those in remote areas or with mobility issues. Third, the government could consider innovative financing models such as subsidized dental vouchers or co-payment scheme to make private dental care more affordable for lower and middle income families. Furthermore, stronger collaboration between the public, private, and academic sectors can help share resources and maintain service quality. Lastly, continuous monitoring and evaluation systems are important to track service usage, patient satisfaction, and equity outcomes. By improving health literacy, accessibility, and affordability, Malaysia can build a more inclusive and sustainable oral health care system that ensures no one is left behind.
Next recommendation is to create a structured way to place and support dental workers in rural regions like Sabah and Sarawak. So just as like we know, Malaysia dentist to population ratio has improved to 1 for every 2343 people, but Sabah and Sarawak still face serious gaps. One dentist serves nearly 4,900 and 3,700 people respectively. This shows the problem is not the total number of dentists, but uneven distribution. Experts say a structured rural deployment program is needed, and World Health Organization recommends mandatory rural service with support measures to retain staff. To make this work, incentives are crucial, like rural allowances, housing, and hardship pay help, but non-financial factors like leadership roles, recognition, and promotion tracks matter too. Combining financial and professional benefits will make rural service sustainable and rewarding, turning it into a stable career instead of a short-term obligation.
The Ministry of Health should strengthen digital infrastructure in clinics and hospitals by providing reliable internet, modern computer systems, and secure platforms for EMR and OHIS, ensuring patients' data is stored and accessed effectively. Continuous digital training is needed to equip dental personnel with the skills to use and maintain these systems confidently. Increased funding and private sector collaboration. It will support innovation and research, while incentives and change management can reduce resistance to digital adoption. Together, these measures will create a more efficient, innovative, and patient-centered oral health care system in Malaysia.
The National Oral Health Policy 2022-2030 show Malaysia's strong commitment to improving oral health and ensuring equal access to quality care for all. The policy focuses on reducing oral disease, expanding service to underserved areas, and promoting preventive care through programs like mobile clinic and teledentistry. It also supports research, innovation, and digital transformation to modernize oral health service in line with the World Health Organization goals and the Sustainable Development Goals. Although challenges remain in funding, workforce distributing, and public awareness, continued collaboration and investment will help strengthen the system. Overall, this policy provides a clear roadmap toward better oral health, reduce inequality, and healthier Malaysia.
So for the last sessions in our presentation is the Q&A sessions. So question 1 is, why is community empowerment is important for the long-term success of national oral health programs? So as we know, community empowerment is important because it encourages people to take responsibility for their own oral health. When individuals are educated and actively involved in the program that has been made, they are more likely to maintain a good oral hygiene and adopt preventive habits. This will help to reduce oral disease in the long run and make the program more sustainable, even after external supports ends. So, as a result, Malaysia has seen some gradual improvements in oral health awareness, especially among the rural populations. Apart from that, it also contributes to lowering the national burdens of oral disease and supports the goals of achieving a better overall health outcomes for Malaysia.
So, next question would be, why is workforce distribution a bigger issue than the total number of dentists? Because having enough dentists overall does not guarantee fair access to care. In Malaysia, most dentists are concentrated in Peninsular Malaysia, while Sabah and Sarawak have very few dentists. This means rural communities still struggle to get treatment even though the total number of dentists in Malaysia has increased. The real challenge is where these dentists are located, not how many exist.
Based on the question, the answer is the integration of research, innovation, and digital technology allows Malaysia to tackle multiple oral healthcare challenges simultaneously. By conducting disease surveillance and health economic studies, policymakers can identify high-cost areas and allocate resources efficiently, helping to reduce financial burden and out-of-pocket expenses for low-income population. Innovation and digital tools such as teledentistry, mobile clinic, and data management system improve accessibility for underserved and rural communities, ensuring more equitable cares. Meanwhile, evidence-based research and technology-driven service model enhance the quality and efficiency of treatments, preventive program, and patient-centered care. Together, these strategies support continuous improvement, policy effectiveness, and align with global health standards, creating the sustainable oral healthcare system that balance cost, access, and quality for all Malaysians.
Okay, so to answer one of my classmates' questions, to implement or to make digital transformation and innovation in Malaysia's oral health sector, the Ministry of Health must strengthen digital infrastructure. This includes reliable internet, update computer systems, and secure digital platforms. Continuous digital training for dental professionals, increased funding, public-private collaboration, and strong change management initiatives are also essential to ensure successful adoption and integration of modern technologies like AMR and OHIS.